Hello, everyone. Happy you joined us. And I'm happy to have my colleague Paul again with us. It is Thursday, and Thursdays are learning and knowledge sessions. So you're in for some good information and very practical tips today. The topic is be clear about your medical condition. And Paul, as you know, and perhaps some of our listeners know as well, is that this is the topic of the week, really. And I've been talking about that in my mini sessions, Monday, Tuesday, and Wednesday. And today, I'm expecting we're going to dive deeply into this topic and kind of go through, a beginning through the processes, through the various steps to be clear, to be aware, be informed, and be progressing and be well stages. So I am really looking forward to that, Paul, because I've come to know that you do a fabulous job at that. And I know that anyone listening to this, either today in our future podcasts, are going to feel the same. So, Paul, over to you.
Thanks, Mark. And I would agree. We're going to run through the whole B stages, if you will, the 5 stages. We've touched on medical conditions and medications in previous podcasts, and kind of you just had we'll say, a unifocus on that. And it's really resides in the Be Clear section. I'll talk about a little bit more about that in a moment. But we want to highlight the idea that it's important to get your feet under you and do the groundwork, do the foundational work, which is what you find in Be Clear and doing a health selfie or getting clear about your medical conditions, and how that becomes a building block to hopefully improvement in health and improvement in wellness and your journey on your path to be well. So as I previously mentioned just a moment ago, we're in the Be Clear section today. And, this is the type of individual we see as a client who would say, I'm suffering from a chronic condition and frustrated that getting help is so difficult. And I'll just tie that into the manifesto of the week, or that we've assigned for this week. Doctors have my best interests in mind. Sometimes they seek alternatives because I've not responded to primary treatments. And, these are two concepts that is after years and years of suffering from chronic conditions, be it pain, be it anxiety, be it sleep issues. It really doesn't matter what the chronic condition is, but experiencing that and hearing those two things can be difficult at times, because the person then is saying, yet another test, yet another specialist, yet another trip to wherever. Because for some people, the specialist isn't near; they're far out of town. And so it ties into the Be Clear that I said, because this frustration stems from the difficulty in getting proper treatment. Why aren't I getting better? And stuff like that. And often what we'll say when we've met this client or a consumer in the clinic setting is, let's hit the pause button. Let's take a break for a moment. Let's figure out where you're at. And I think to highlight that from a high level, I'd like to bring up Kareen, if you could, in a moment here. Kareen, if you want to hear your story, really powerful story, excellent story, lots of teaching points in there. She was a podcast. She's episode number 8, and she shared her story with us. You can find her podcast at podcast.weedwell.com. And Mark, I'll leave it to you to kind of introduce the story and tie it into exactly what we're talking about in the Be Clear and the manifesto and that.
Yeah, absolutely, Paul. Happy to do so. But I will say a disclosure up front is Kareen's story is so, the word that comes to mind is intense, because it really is. My interpretation or summary of it is not going to get anywhere near really what she has really gone through. And as you said, Paul, I would encourage any listeners to go to our podcast number 8, to listen to the full story. You'll be touched, I'm sure. So, Kareen, a lifelong journey of pain and doctors and hospitals interrupting her family life, in every way possible, missing out on the great events of a family, and that's weddings, and the list just goes on, having to uproot from where she had been living with her husband and family. In a city, and having to uproot and go to a smaller location, and really all of those things involve the stigma associated with the amount of pain medication that she was on. I'm sure, Paul, you'll talk about the pain pump. I wasn't aware or familiar with pain pumps prior to her story, and I suspect that some of our listeners would be the same. But I cannot imagine really what she has gone through. And she was at a point in her life that she had to do exactly what you said, is recognize where she was at, continuing down the same path. Nothing else is going to change. It's only going to get worse, if anything. And she basically came to that realization, hit the pause button, reset, and say, what are the things that I need to do and implement to be able to, see some changes happening. And Paul, as you said earlier, patients often that would come to see us in the clinic would say that they're frustrated. They're frustrated because they're not seeing the results, or they're frustrated because the information that they see online is confusing, and they find themselves in a vicious cycle. And when in that vicious cycle, you're obviously not moving forward, and that just compounds the frustration. And maybe now they're supplementing even the existing medication with other medication to help them cope with where they're at and without seeing results. So, Paul, over to you.
So, I think the reset button, the pause button that you mentioned is a great place to start. And it's a way to, as best as possible, separate the previous events to you're starting something new. And that's kind of how we framed it in a clinical setting previously, so the person can start moving forward there. The biases still exist, of course. They don't go away. It's their lifelong experience of suffering and stuff like that. So it doesn't go away, but we try to start with a clean slate, a fresh start. The health selfie, we have a sample, is something you can do as an exercise. And this is at weedwell.tips in our Be Clear section. There is a diagram, and you'll see two bodies on it, two avatars, a front and a back. And one of the first things that you can do, it has a list at the top. You can put in your medical conditions. And so if you're not aware of them, this is a good start in gaining clarity on your current state of health. And whether you use your pharmacist, maybe they can explain via the medications you're taking, the conditions you're trying to treat. You can use your doctor or nurse practitioner or whomever you see. Or if it's we'll say a more advanced condition, your specialist, if you're unsure about that. But just getting a handle on what it is, your list might be one thing. That's easy. We meet often people with lists of 5, 6, 8, 9 things. And sometimes it's hard to keep that in order. Along with all the medications, of course, that go with it. But you can use those bodies as an exercise as well to circle where you're affected by it. We meet people with pain syndromes that aren't just in one place. I just don't have belly pain all day, but I have belly, back, my shoulders messed up from work, and all sorts of things. And as you start piecing those together, you figure out over time, and what it's going to lead us into is what's more important to get under control, or what has arisen from the original condition that I'm now dealing with at the present time. And we'll kind of evolve our conversation to that in just a moment. But as you get a handle on this list, and if it's large, if it's small, what you really want to focus on is those one, maybe two things that would be most important for you to get under control. And it kind of becomes the basis of your SMART goal, or in our Be Aware section of our 5 Bs, that's really the goal, the culmination of Be Aware is coming up with a health goal, something you can focus on. So you have that big list. All you're doing is breaking down the list to something that's important to you, something that you can work on. And as I said, today we're going to take you through a journey. You kind of see now the foundation really beginning to develop here, having a handle on where you've been to the present time, and then now what you want to work towards or move forward to, or what's important in your life.
That's right, Paul. And in addition to recognizing, where you're at and doing a pause and a reset, I think it's important as well for the client to accept where they are, as opposed to being frustrated and feeling discouraged by that. Just say, it is what it is. I am here now. Looking at the previous steps is not going to get me forward. Where do we go from here? And as you talked, setting some goals, and I'm sure you have a lot more to add to that.
So I just will go back to the getting clear part for a second. And when I look through, as an example, the comments on our Facebook group now, you actually can see the people have been through this process. Now, we meet people, they're in various stages. They might be in Be Clear, they might be in Be Informed, but you can actually see, and you start reading the comments, they've already gone through this. And the reason I say this is, as you begin to get an idea and accept where you are with these diagnoses or these conditions, symptoms that you deal with regularly, this is a point where, if you're not sure about it, start asking, start doing your own research, because in this sense, knowledge is power. And I've seen a number of people actually say that, and they're trying to direct their treatment. We've always said it's important to incorporate your healthcare practitioners, whomever you see, primary care or specialists or whatever. But having some knowledge allows you to advocate for your health. And that's something we've always said is important. And so now you go from, if you picture this, doing the exercise and not having any idea of what you're doing, you get a handle on what it is that you're dealing with. And now you have some knowledge, so you can assist yourself in where it is that you want to go. You're not, I don't mean this in a negative sense, but you're not reliant on the doctor directing you. You know, you need to do this. You can have, we'll say, a more fulsome conversation with the doctor or whomever that is, and kind of co-direct your treatment. And, when you have that input, you're more likely to work towards things. You feel stronger or might have more conviction towards the treatment plan. And this is all going to lend itself to when you actually get to launch phase, whatever that treatment is, if it's cannabis, if it's a completely different other treatment altogether. But, I've just given you 2 or 3 points where you really get that foundational work, and it's a really strong base that we're building on. And so, that ties in kind of a be clear and be aware and the things that you're looking for.
Yeah, exactly, Paul. So the first event really is to recognize that something has to change, and then apply everything you've said in the Be Clear, because as you've already mentioned, it is the foundation, and the foundation, no different than a house, is so vital, so critical, and it will really impact the outcome of the overall, in this case, journey, because you're going to be building on top of that. So take the time to do that. It is crucial and it is foundational. I can't say that enough, because now you're going to be building layers upon what you've established in the Be Clear stage.
Yes. And so when we come to our health goal, as I said, try to focus on that one thing or two things that are most important to you. But one thing to decipher between, and we've introduced this to our group at least with various posts, what's primary condition and what's a secondary condition? excuse me, and what you want to look at is if there's conditions that kind of stemmed from or came about afterwards, it's probably secondary in nature. Often, here's a situation we'll see. I've had pain, I've had chronic pain, I've had what feels like a million specialists and doctor's appointments, and they still haven't been able to figure it out. I'm no better. In fact, I feel like I'm getting worse. And as that exists, those feelings exist, what we see it manifest as is an increase in anxiety because you may be forced to do things that are uncomfortable, as in more painful, or flat out depression, where it just feels like you've been beaten down for so long. I'm not getting any better, or I'm getting worse, and so really in that sense, it's a secondary condition. Now, why is that important? You can focus on the depression, but more than likely in this type of scenario, if the pain is something that you can get under control or under control a little bit better, we tend to see that depression kind of eases itself just on its own, unmedicated and whatever, because it stems from the secondary condition. And so that's why we bring up the idea of primary secondary condition. Not that it's exclusively this way, but it's something you want to keep in mind, that if you focus on kind of the underlying or primary condition, it has a way of helping you or lift you up and treat some of these secondary things.
Yeah, Paul, and without doing that, so identifying the primary and secondary conditions, it could easily cause you to be in that vicious cycle, because you're trying to treat, say, the depression or the high anxiety, but really, if you look back, the source of all of that, or most of that, is really that excruciating pain that you've been tolerating for quite some time. So important to do that as well.
Where I remember seeing this in a clinical setting, it was quite profound. Where you would meet someone on day one, and they would bring their spouse, and they went through some length of treatment, and you see them again in 3 months or 6 months or whatever it is, and the patient themselves would say, "I feel a little bit better," and the spouse inevitably was the one to jump up. Well, you're not as crusty anymore. You're doing this around the house, whatever it is. But they were giving specific examples to certain activities that they weren't able to do previously. Another reason why we really want to focus on good health goals that are appropriate to us. But that other person, the spouse in the room, was able to pick up what was different, even though, if we use the example of a pain syndrome, maybe the pain was like just a teeny tiny bit better. But the other person was saying, no, this is a profound change because your mood is so much better. You're much more fun to be around, and you're able to do some more things. And it was always interesting when you had two people come into the office and you'd get one description, and then the person watching it kind of gave a different description.
Actually, thanks for bringing that up, Paul, because those examples actually are probably more common than what most would expect. But absolutely, and that was a real good example where the spouse could even say, "You're a better person to be around with right now." And it may not be that it's been giant steps. It could be 1 on a scale of 10 decrease in pain level. But as you said, if it allows the individual now to be able to wash the dishes, well, that's mobility as opposed to sitting or lying down somewhere. And then it's stimulating as well, because you're able to do something that you struggled doing before. And then that starts playing on your mental and emotional aspect as well. So, and others around you will feel that.
Yeah, so we'll bring it into kind of the be informed, be progressing area now to this, journey, if you will. And it's the idea that, separating the primary and secondary and really focusing on what that health goal, what was important to you to solve. is where you would focus, as an example, what cannabis or how I might consume it. And you want to focus on there, because if you try to incorporate a treatment plan that does everything, you're going to find that it does nothing at the same time. And so, again, right back to the foundational work, getting that unifocus to where you want to be. Now or allows you to incorporate something specific as a treatment plan to help you move forward to where it is that you want to go. And so that's where be informed and then be progressing, being the part where you actually implement it and are able to measure and adjust your dosing based on how you feel. I feel no better. I feel much better. And it allows you to adjust what it is that you're doing. In the cannabis sense, what you're consuming, how you're consuming, it allows you to adjust that way. But honestly, this is a concept that works for any treatment plan. It might be, again, a wrecked shoulder from work and you're going through physiotherapy. Well, this adjustment and how it's working works for that if you're doing physiotherapy exercises for it. This exercise works really well. This one hurts me. I'm not ready for it yet. And you can adjust accordingly. So that's kind of getting our foundation and now getting into launch mode and taking off and actually doing treatments, doing therapies, and how it fits into kind of our story.
Mm-hmm. Yeah, Paul, taking those steps, and as you've said, they do build on each other. We live in a society of we're looking for quick results. If we're hungry, we'll grab what's easy, whether it's easy in the fridge or you're out and about and it's a drive-through. That's going to satisfy your belly and your hunger pain, perhaps on a short duration, but it's not necessarily the best thing for you. Where I'm going with that is we live in a society that wants immediate results, and it's all around us on the internet, you name it, it's all there. This is different. You need to stop and focus and reset and build it in steps as you've identified already.
It is hard work, and that's just the way it is. What you're getting here in discussion and in previous podcasts, though, are little tidbits of information that you can take away to make that hard process a little less difficult. To our person that we introduced at the start to kind of guide the framework of the importance of getting a foundation, Corrine, she spent the better part of a year trying to get to where she wanted to be. She got there. Once she got there, she can begin this process all over again. You always want to be forward moving as best as possible, especially when it comes to your health, as much as you can. And so, you brought up the pain pump. I'll just touch on that for a moment to kind of close that loop. It's just access, IV access to have at your leisure, continuous medication, but at your leisure is not the right words.
Discretion.
The ability to top up as needed, which was prescribed because the pain was so bad, or the regular dose wasn't, we'll say cutting it, wasn't taking the edge off the pain. And so, for her, she described large amounts of pain medications and something she really wasn't interested in, but was trying to get by. And so it's quite a change in mindset just for her to go through the process again, because as you mentioned in your intro, it's years long suffering. So in any event, she did the foundational work and set what her goal was. I don't want that pump. I don't want to be carrying around that thing all the time. That was her goal. And, you see her journey kind of highlighted into a lot of the stuff that we're talking about, foundational work to the launch phase, to adjusting things on the go, which she had to do as most any medicator with cannabis will do. You increase your dosing, you adjust how you're taking it, or whatever the case may be, to the point where you get to that sweet spot. For her, that sweet spot was her health goal of getting off that pain pump. But just because you reach that goal, and now it's time to do it again, right?
Yes, Paul. Paul, I think worthy of mentioning as well is all of us when she identified that her goal was to be off the pain pump in 1 year. We all recognize that to be pretty ambitious to the point of really aggressive goals. And I don't know about you, but I was a little skeptical as to whether or not that was even realistic. But she did do that, and really that says a lot about who she is as a person and her determination. But it's the groundwork, the foundational work that she was able to do when she was in a tough spot and said, something's got to give, something's got to change, and I need to be an advocate for myself. And how do I do that? Despite all the good care that she had received, she recognized that there was something missing, and she did that. And as you've already said, and I will reiterate, she did achieve those remarkable goals.
Yeah, it's the ability to get behind it yourself, and that's why the health goal has to be important to you, and you can push and push, and as you said, be determined. So we'll switch our focus just for a moment from there and kind of wrap up our stage Be Well. We've done the foundational work in the Be Clear, Be Aware, and kind of the pre-launch, launch phase in Be Informed and be progressing in how doing this foundational work and setting up your treatment plan is going to fit into that. And finally, Be Well. And we did a conversation about 3 or 4 weeks ago now on complementary and alternative medicines. And one of the discussions during that, and I'll just bring it up briefly, was the idea that if you tried to introduce some of these complementary or alternative medicines, and it doesn't matter if it's chiropractic, it really doesn't matter if it's vitamins, aromatherapy, while you're in the Be Clear, or when we described Corrine on day one when we first met her and she described how she felt, the conversation is lost because you're totally, we'll say, out of control, as in the symptoms management is totally out of control, and that conversation would be lost. And it's only going to have potential to become part of a treatment plan kind of after you got some things under control. And so when we talk complementary or alternative medicines, it's these things that you can do either in addition to or in place of, we'll say, traditional Western medicines, and things that may lend themselves to moving you along your path to wellness, moving you along to that health goal that you chose. So that's why we bring it up and Be Well. And that's kind of your clincher if you talk journey from day one or phase one, if you will, and journey to when you're much better or more in a Be Well phase. You're muted, Mark.
I thought I would be able to go through an entire session without doing that. And whenever I take a sip, I do mute it, and we know the outcome of that.
Yeah.
So, Paul, with that, I lost my total train of thought here.
Okay. So I will, how about I'll do a little summary, and then, because I think we've covered our steps here. So, the basis of Korean and a lot of the people that we meet with chronic medical conditions that they've experienced for many months, if not years, is a demeanor of frustration. When am I going to get better? How am I going to get better? Does it get better for me? And so we have, primary conditions that you're dealing with, but then the secondary that comes from, dealing with those types of feelings for years. And so we always say, hit the pause button, get things clear again, try to gain some clarity. And for some people, it's square one there. And for other people, they have a handle on things. But if you need help, that's a resource we have at weedwell.tips, where you actually explain your medical conditions, and that's kind of the core of what we're talking about. So once you get a handle on that, and you have an idea of your list, one thing, two thing, 8 things, 9 things, whatever that is, start learning about it so you can be a strong advocate for yourself. Focus on the thing, or maybe couple of things, but the thing that is going to be most important to you when you're focusing on making a health goal, somewhere where you see yourself in the future. And as you focus on that one thing, you can tailor your treatment plan to that one thing. Don't worry about treating everything all at once. Try to focus on that one thing, get a handle on it. You may notice that some of these secondary or symptoms that popped up after the fact reside just by getting that one thing under control. And then as much as possible, as you begin to feel better, hopefully, you can start incorporating some other medicines or some other specialties, aromatherapies, what have you, and hopefully that even brings you further along your path to wellness. That's our story today.
Yeah, very good and good summary there, Paul. Um, and to our viewers today, just a reminder, and for your purposes, I've included in the post the links that Paul referred to earlier. So the podcast.weedwell.com and the other one about weedwell.tips. So they're included in there. So feel free to reference those and valuable information throughout. And while you're in the podcast area, look at the titles. They give a brief description of what you can expect if you were to listen to it, and those that you find would be of interest. By all means, take the time to do so. Patient stories are extremely precious because they're real life stories, and we have a multitude of them, and they're all different in their own way. So, Paul, topic for next week is sleep diary and hygiene. So, what would our listeners and viewers expect to see or hear next week?
I think a brief overview would be this. We see a lot of people with sleep issues. Um, to tie into today, a lot of times it is a secondary issue to pain or to anxiety or some other condition. But there are things that you can do before introducing cannabis or pharmaceutical treatment, whether it's sleep hygiene items that we'll discuss through the week. And then you want to incorporate a diary, and we'll talk about how you incorporate a diary and how it relates to the sleep hygiene. But you want to do these things before you introduce some of the medications, or if you're looking at using cannabis, though we will talk about how the medications and cannabis does fit into a treatment plan.
Well, Paul, I'm looking forward to it, and I'm sure our listeners are as well. So, Paul, thank you for today. I thoroughly enjoyed it, as usual. And now I would like to end this session by providing some disclosures. So I'd like to remind our audience that these information sessions are indeed intended for individuals who are generally in good health, are generally well adjusted, and are functioning effectively, and they're not in need of medical treatment, including for mental health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders, and does not prevent, cure, or treat any mental disorders or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent that is necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those of you who have taken steps in improving their quality of life, congratulations. And remember that your journey is your journey. And as long as you're taking some steps forward in improving your quality of life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life. And using cannabis as a treatment option is one way to accomplish that. On behalf of Paul and Doug, who's not with us today, and myself, we always look forward to the next time that we would connect. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.